Your screening patient has a Pol B2 variant of unknown clinical significance. What do you do with that? Are they high risk? Do they need a breast MRI? Let's find out. Genetic testing has exploded in popularity. Multi-gene panel testing is occurring at a rapid pace. These tests involve analyzing DNA of 28, 35, 49, or even more genes. Sometimes they come back showing a true gene abnormality, like a BRCA or BRCA gene mutation. If this occurs, clinical management is fairly straightforward. Additional high-risk screening with breast MRI is recommended. However, what happens if the genetic testing results are not quite so clear? Anytime a patient has genetic testing, there are three potential outcomes. The first outcome is that it comes back positive. It shows a deleterious gene mutation. This means that the patient has an increased cancer risk. The second possible testing outcome is a negative result, and there are two subcategories of negative results. You can have a true negative, and this occurs when a patient undergoes genetic testing and the result comes back not showing any gene abnormality. And in addition to that, there is a gene abnormality previously identified within the family. So a patient's mother tests positive for the BRCA gene, but the daughter tests negative. This is a true negative, meaning she inherited her DNA from her father instead, and she is at no increased risk of malignancy. The second subcategory of negative results is what we refer to as negative, but check back later. And that is if a patient is the first person tested within their family. The testing did not reveal a gene abnormality, but their overall cancer risk remains unknown. In this case, you defer to individual risk model estimates like the Tyrer-Cuzick model or Gale model to determine a person's risk and eligibility for high-risk screening exams. The last genetic testing outcome is a variant of unknown clinical significance. These genetic variants are frustrating and oftentimes confusing. What it means is that there is not enough data to determine the impact of the variant. The DNA is changed, there is a mutation, but we don't know whether that has any clinical impact or not. Additional information is necessary to determine this clinical significance. Unfortunately, more than 20% of genetic testing results show a variant of unknown clinical significance. This is a very common problem. So what do we do with these variants? The first thing we try is reclassification efforts. First, check all existing databases. Unfortunately, not all genetic testing results are kept in one location. So a thorough review of all of that particular type of genetic mutation can sometimes reveal more information as to whether or not it confers any clinical significance. The second reclassification effort is to try and enroll the patient in family studies. Occasionally, if there's only a small number of a particular genetic variant that has ever been identified, the genetic testing companies may be interested in offering free or lower priced genetic testing for additional family members to try and sort out the true impact of this variant. But unfortunately, most of the time, what is required to reclassify a variant is more data, more instances of that variant, and that requires more time. This ends up being a waiting game, where eventually they will usually get sorted out. It may take several months, it may take several years before that process is complete. Overall, approximately 90% of genetic variants will be reclassified as benign, meaning there is a change to the DNA, but it does not confer any clinical impact. Only 10% of these genetic variants will end up being deleterious or pathogenic, where they do lead to an increased risk of developing cancer. So while you're waiting for clarification, it's usually recommended to treat these variants as negative. Basically, ignore them. Instead, defer to risk models to guide imaging and clinical management. It is vitally important, though, that these genetic variants are tracked and followed up upon so that they can eventually be reclassified.
Thank you for watching. Please click subscribe to see more of our content, or go to MAMMOGUIDE.COM to learn more about breast imaging.